Let us now go to visual diagnosis of the skin. The topic is Let us now go to visual diagnosis of the skin. The topic is acupuncture for eczema. Let us look at the full conditions of eczema. First is damp heat with predominance of heat. There will be red papular rash, vesicles, exudate, erosion, itching, feeling of heat of the limbs, swollen red and painful joints, epigastric fullness, sticky and bitter taste, thirst with no desire to drink, feeling of heaviness of the head and body, feeling of heat, and the tongue will be red with a sticky yellow coating, and the pulse will be slippery rapid. The acupuncture points to be used are spleen 9, Ren 9, Ren 5, bladder 22, spleen 2, and LI 11. Next is damp heat with predominance of dampness. There will be red papular rash, vesicles, exudate, weeping skin eruptions, thickening of the skin, itching, epigastric fullness, sticky taste, thirst with no desire to drink, feeling of heaviness of the head and body, sticky yellow tongue coating, and a slippery rapid pulse. The acupuncture points to be used are spleen 9, Ren 5, bladder 22, and spleen 6. For empty conditions of eczema, there is blood deficiency and dryness. There will be chronic eczema, pale red skin eruptions, dry skin, erosion, itching, thickening of the skin, ridging of the skin, dry hair, brittle nails, dizziness, blurred vision, floaters, numbness or tingling of the limbs, scanty menstruation, and a dull pale complexion, with a pale tongue and a pulse that is choppy or fine. The acupuncture points to be used are liver 8, stomach 36, spleen 6, Ren 4, and kidney 6. Next is spleen Qi deficiency with dampness. This is chronic eczema. There will be pale red papular rash, vesicles, exudate, weeping skin eruptions, slight itching, poor appetite, slight abdominal distension after eating, tiredness, lassitude, pale or sallow complexion, weakness of the limbs, loose stools, abdominal fullness, feeling of heaviness, sticky taste, poor digestion, undigested food in the stools, nausea, dull frontal headache, excessive vaginal discharge, with a pale tongue with a sticky coating and a soggy pulse. As a clinical note, atopic eczema in children is caused by a congenital deficiency of the defensive Qi systems of the lungs and kidneys. For genital eczema due to damp heat in the liver channel, there will be papules that ooze a fluid, and the genital area will be red and moist. There will be vaginal itching and difficulty in urination. The tongue will be red on the sides with a sticky yellow coating, and the pulse will be slippery wiry. For genital eczema due to blood deficiency and dryness, there will be thickening of the skin, dryness of the vagina, a dry red rash with vaginal itching. The tongue will be pale and dry, and the pulse will be choppy or fine. Thank you so much for your attention.